Good afternoon, and welcome back to the Reckon Interview Live. I'm John Hammontree, and today we are chatting with Robyn Hyden, Executive Director of Alabama Arise. Robyn, thanks for coming on the show.
Good afternoon, John. Thank you for having me.
As we let people join the show, can you tell us a little bit about what Arise is and what y'all's mission is?
Sure. Arise is a 30-year-old community-based organization. We're a coalition of faith-based nonprofit and civic partners uniting to address policy at the state legislature. We believe that state policies are what is driving our state's high rates of poverty, and we can address that by advocating, by speaking out, and by organizing in our communities. So we have 158 member groups. We have thousands of partners and members across our state. And our theory of change is that if we get more everyday citizens and people who are impacted by poverty speaking out, educated on policy issues, and uniting for change, we can begin to make change in our state.
And you guys also put together one of the best daily newsletters for anybody who wants to keep up to date on all the news coming out of Alabama and around the Southeast and the country for that matter. Go to alarise.org, alarise.org, and sign up for their newsletter. Y'all cover a variety of issues. Obviously, poverty is an expansive topic here in Alabama and around the country. But today we are going to focus on the healthcare system in particular. We've been talking about it all week on the Reckon Interview podcast. And a new report out today, the Social Progress Index finds that globally, the United States has fallen from 19th to 28th in overall social quality of life. A big part of that is we have dropped to 97 in access to quality healthcare. One of the things that you and I were talking about before we started this call was the Medicaid expansion efforts that are being led by your group and a new coalition of southern states. 8 southern states have joined together to push for Medicaid expansion. A number of people who are uninsured in the people who are uninsured in America live in the South. What is this coalition, and what are y'all pushing for right now?
Yeah, so thank you for talking about healthcare all week. It is such an expansive issue. So I'm really passionate about healthcare because I came on board to Arise as a community organizer in 2013, educating people about the Affordable Care Act and ways to access health coverage. Arise has been working to expand Medicaid for the past 10 years, ever since our state was given the opportunity to opt in to the Affordable Care Act to cover low-income adults fully, and we elected not to. We've been saying that has got to change. So we are part of the Cover Alabama Coalition, which is a statewide coalition. It goes beyond just Arise and our typical folks. It's business community, it's medical providers, it's major health advocacy groups like the Cancer Society and the Heart Association. And then we've also now realized, hey, these 8 southern states who are really holding out, we are losing millions of dollars. We're losing thousands and thousands of people to premature death. And we're all united in saying, this is not, this is an issue that our individual states need to address. This is also an issue for Congress to address. So it's called Southerners for Medicaid Expansion, I think is the name. And we are joining together to do some vigils and some consciousness raising events about this problem and how it impacts 7 million people just across the US South don't have health insurance because our states individually made this decision to leave a whole bunch of people out of the Affordable Care Act.
Can you walk us through, for those of us who aren't, healthcare policy experts, what Medicaid expansion would do? How many people might it affect in a state like Alabama, for example?
Yeah, so currently there's over 300,000 people that we estimate post-COVID who even, there were many people before COVID and now more even because of job loss who don't have affordable health insurance. And if our state would expand Medicaid, they would qualify for Medicaid. So most of us aren't really familiar with Medicaid and what it does. It's a federally funded program that also requires a state match to fund. And Alabama has one of the most restrictive Medicaid programs in the entire country. I think Texas is the only one that's less expansive. So essentially, if I was a single mom, I would have to make around $300 something a month or less to be poor enough to qualify for my own health insurance coverage. That's just unreasonably low. That covers very, very few working aged adults. Medicaid does cover 1 in 5 people in our state, so it covers a bunch of children. We should be very proud of the fact that we have really high rates of health coverage for children. That's because of policy decisions that we made decades ago. It covers a lot of elderly people in nursing homes and people with disabilities. But who it's not covering and who is still left out of this coverage are just the everyday workers and folks that we rely on to keep our community going. You know, it's people like stay-at-home caregivers, preschool teachers and daycare workers, the people who are custodians who we're relying on to sanitize public spaces right now. You know, even people who work in pharmacies or are assistants in healthcare may not even have their own health coverage. And if Alabama would take this step and say, okay, currently you have to be way down here in terms of income to get help, to get Medicaid. And then you get up to the poverty level. Let's say you make $17,000 a year, you know, for a family. Suddenly you can afford,
not a lot,
not very much money.
Yeah.
Then there's help for you available through the Affordable Care Act. But what about people in the middle? They're not quite at the poverty line. They don't quite make enough for the Affordable Care Act. They're not just destitute. They're workers, they're caregivers, and it's about 300,000 people. And the way this was meant to be implemented is that, as I said, the federal government provides a portion of funding, and they have really incentivized states to make this expansion by boosting the amount of money that's on the table. So typically for Medicaid, we pay about 30% of the cost from our state's general fund budget. And the returns on that investment are great in terms of productivity, public health, our ability to respond to things like COVID, you know, or other concerns. When we have more children and more elders covered, we all benefit from that. But if we were to expand Medicaid, the feds would actually pay 90% of that cost. So it would just be billions of dollars coming into our economy, allowing us to expand services, to pay providers. And whether you are currently uninsured or not, it would actually help benefit the entire health system that we're all relying on.
Well, I think that's something that people don't necessarily immediately understand. And I quickly want to remind everybody who's watching, this is a live show. We are happy to take your questions. If you have questions, please leave them in the comments and we'll try to address them as best we can. But one thing that we've seen, I guess, particularly during this pandemic is, you know, the strains on Alabama's existing healthcare infrastructure. And Medicaid expansion would, of course, help individual families and people who are struggling to get health insurance, but it might also help struggling hospitals, particularly in Alabama's rural communities, receive some compensation for the care that they are providing to their community. Because my understanding is, if uninsured people show up, you know, let's say for a COVID screening at a hospital, the hospital does have a duty to treat those people, and they either those patients are going to be saddled with a lifetime of medical debt, or the hospital is just not going to receive any compensation in return. Is that right?
That's correct. And so what happens is all of us are paying higher premiums. This was actually a law that was passed under Ronald Reagan. And it's this idea that if people show up and they're dying, you know, the code of ethics that doctors sign says that we're going to treat you, right? But we all know how big those hospital bills can be. So hospitals are paying for very expensive treatment. You know, you talked earlier about how the U.S. has some of the lowest quality of life in the world because of our healthcare system, and yet we're spending so much money. Well, what's happening is that we're not spending that money effectively, because you basically, if you're uninsured, the only way for you to get coverage sometimes is to be dying. You know, you get diagnosed with stage 4 cancer. Your diabetes has progressed to a very serious point, and suddenly you're facing amputation or even early death. Whereas if we would be treating those people humanely and effectively with just regular ongoing care and support, our healthcare system would be spending a lot less on that treatment. Hospitals and doctors would be on the hook for a lot less unpaid and uncompensated care. And overall, the public health expenses that we're facing, especially in a state like Alabama where our health outcomes are pretty bad across the board, those would improve, and we would all see the benefits of that.
We have a question from Amy Smith. It's a great one. Can Governor Ivey use some of the CARES Act money to fund Medicaid expansion? And can she do it by decree, or would everyone's hair catch on fire if she did? Would she need legislative approval to expand Medicaid, or could she do it using emergency powers?
So there's two pieces to this question. The first is that CARES Act money itself cannot be used to pay the state's match. My understanding of that complicated issue is the fact that we have to pay a 10% match, and we can't pay a federal match with federal money. So it's federal money. We've got to come up with our own money to match the Medicaid cost. The second piece about whether the governor needs legislative action, she really does not. If the money is there and the governor wants to decree, it's simply a rule change that changes the eligibility for who's eligible for Medicaid. Currently, it's way, way, way down here. And if she could submit this rule change, it's a waiver that's submitted through Medicaid. The legislature wouldn't have to approve it. Now, would anybody's hair catch on fire? I would hope not. And I will say this, privately, we talk with legislators who say, wow, we should have done this. We know that it would help a lot of people in our districts. Bipartisan Democrat and Republican lawmakers, especially in rural areas, know this would really help. The question is, how are we going to get it done, and who's going to step up as a leader and say, yeah, this is an investment we can make, because they've got to come up with that 10% match.
Now, you said this is a bipartisan issue, and as we look around the country, just 12 states have not expanded Medicaid. 8 of them are in the South and are part of this coalition that we've been talking about. And so that means that a lot of Republican-led states have passed this. I mean, part of the boogeyman behind it has been that it has been associated with Obamacare, but even, current Vice President Mike Pence, I believe, oversaw the expansion of Medicaid in Indiana while he was governor there. We have seen 4 states in the South. If we're going to use sort of a broader definition of the South, we've seen Arkansas, Louisiana, Kentucky, and Virginia expand Medicaid. What are some comparisons to, say, a state that's similar to ours, like Louisiana, that might give us an indication of how our state would benefit from a Medicaid expansion?
I think that's a great comparison, because Louisiana has had Medicaid for many years now. And what we see is across the board better public health outcomes. We see fewer or no hospitals, rural hospitals are closing in those states. We see that when they're trying to gear up and staff up to respond to critical health crises, they have the funding to do it. We also see that their state budgets have really benefited. The expansion has demonstrably created jobs. It's like the biggest economic development package that our state could be doing. And if we saw a state like Louisiana come in and take that kind of economic development package from us, normally I think we would be really upset about it. So, if we think about it in that way, our federal tax dollars, those, when we pay those are going to fund healthcare in Louisiana and Kentucky. And our people are not benefiting from that. And that's a real shame. And they've been able to address issues like criminal justice reform, which has a direct tie to, being able to provide more mental health treatment in community, being able to provide reentry services and substance use disorder treatments. There's numerous peer-reviewed studies. There's, omnibus studies that round up all of those studies. And as more and more Republican-led states are signing on, the evidence across the board is consistent that it doesn't matter how long you wait to do it. When you do it, it is very beneficial.
Let's talk a little bit more about mental health. We have a question or a comment from Cher Graham, simply asking about mental health. We have seen most state-run mental health facilities in Alabama close in the last decade. Would Medicaid expansion offer some resources to mental health patients and to those facilities?
Yeah, that is a really important issue to me and my family. My husband lives with a serious mental illness, and he was diagnosed in a state that had comprehensive community-based services. And when we when we got married and he moved back here, it just felt like, the services weren't there, even for people who had insurance to access them. So the critical issue has been state funding. Our state funding has not only been flat, it's really declined for services like mental health, and we're all paying the price for that. With Medicaid expansion, I don't have the exact numbers in front of me, but currently our state pays out of pocket to provide a lot of those services with no federal matching money. Now, imagine if we could serve some of those same clients and patients who are uninsured, and suddenly 90% of their care is paid for by Medicaid. I mean, that's tremendous. And that doesn't necessarily mean our state would need to spend less on mental health services. What it means is that we get way more bang for our buck, and that money we're putting into mental health is going further. It's going 10 times as far, and serving 10 times as many people. And, it has been a real shame that when the way we've shifted mental health services onto things like local police departments and jails, when they're not equipped to handle people in crisis or to handle people with addiction crises. And we all know that, just having someone the care they need at the moment they need it, making sure they have insurance, making sure that the provider is there. And then when that person says, I need help or I'm ready to get help, you can send them there. It would be life-changing for so many people and communities.
Well, and, anytime we have conversations about gun violence, a lot of our legislators respond that it's a mental health issue. And if that is indeed the case, then we can put a lot more funding towards mental health through the expansion of Medicaid. We have another question from Pamela Chu. She says, I'm really enjoying this conversation. There's so much we don't know about Medicaid in Alabama. I would like to ask the following: how much does the state of Alabama spend on corporate subsidies as compared to Medicaid? I don't know if that's one you know off the top of your head or not.
Pamela, that's a great question. And that gets at the question of priorities. We spend money on what we value. Our state is not very transparent about these economic incentive packages that we provide. We were one of the first states to pioneer giving massive tax giveaways to corporations like Mercedes. Now, we should be very proud that, we have more manufacturing jobs and people coming to Alabama, but we're spending a lot of money to bring those jobs here and to train workers for those jobs. And there's no comparison. When you look at a $1 billion incentive deal for a manufacturer, or even $100,000, we've gotten some estimates about what it would cost us for year one of Medicaid expansion. And it's $169 million is what we're estimating for just the first year. And the payoff would be, hundreds of thousands of people accessing healthcare, 30,000 jobs created, huge benefit to our education trust fund revenue and to local tax revenues. And we can show the economic impact and how it would help people. And we don't have that kind of transparency about a lot of economic incentives. I know that we have fiscal conservatives in our government who've said, hey, we need to track these incentives better. That's one area where Arise really hopes to partner more with lawmakers on, because we feel like, if our state spends any money, we need to know the benefit for that money. We can clearly point to the value and the benefit of expansion, and we think we should be looking at all of our spending that way.
Well, and another point of comparison for spending might be the governor's prison plan, which she is also doing without legislative approval. And certainly we have decided we as a state will make that a priority. And it's interesting that you mentioned that that healthcare is related to the prison overpopulation issue, that we send a lot of people to prisons who wouldn't otherwise be there due to mental health facilities and lack of funding there. So that's certainly an interesting comparison between our priorities.
Yeah, and I know we don't have a lot of transparency about the prison construction cost. I heard it was in the range of over $2 billion for the term.
And that's billion with a B, right?
Billion with a B.
Yeah. And
so we're talking about first year of Medicaid expansion that's less than 1/10 of that cost. I mean, it's just unbelievable. So the benefit that could bring, and those issues are linked. The DOJ report about the violence and suffering in our prisons is is extremely disturbing. I think all of us who pay taxes and who live in this state and who support our state's infrastructure should be looking really critically at that. And what the Trump's Department of Justice said was, we will not solve this problem just by building prisons. In fact, they said we need to look at things like sentencing, healthcare and treatment of people within prisons, and the way we reintegrate people after their release. So Medicaid expansion is something that can help with a lot of pieces that need to go into that puzzle.
We have another question from Amy. She says, Senator Doug Jones is trying to get a Medicaid expansion incentive bill passed in Congress. In normal people terms, what is this bill and what would it do?
Thanks for asking. I'm really grateful that Senator Jones and Representative Terry Sewell have co-sponsored this act, which I believe is called the HEALS Act. And, in normal people terms, back when we first had the option to expand Medicaid, our state would have gotten 100% of that cost fully funded for 3 years. It was a huge benefit. It was a big incentive to a lot of states, but a lot of states like ours held out. So now we no longer have that carrot. We no longer have a 100% match. It's 90%, which is still great. If anybody, wants to give me $90 for every $10 I give them, I will gladly take that deal. But, Doug Jones has noticed that the biggest thing holding back our leadership is that lack of a 100% match. And if that came back, even for 3 years as it was originally, that would help a lot of these remaining holdout states, like these 8 southern states that we're a part of. Just make the decision really simple. How are we going to pay for it? Oh, it's paid for 3 years. And the economic analysis that partners have done, like UAB put out a study about this. If that cost was fully funded 100% for 3 years, our state would just be raking in money, and it would fully pay for the cost of sustaining the program, even if we have to pay a 10% match, which is what we currently are paying. Now, even that said, so we would love to see that bill pass. We really want Congress to do their job and to go back and to pass comprehensive COVID relief and funding for Medicaid. Boosting the Medicaid match is a key critical piece of that, because Medicaid is a huge part of our budget and other states' budgets. It's a huge piece of addressing COVID. So that said, even if Congress doesn't bring back that 100% match, we would love to see it. We still think the economic case is really simple and really clear. We're talking about our state putting a little bit of money on the table to fund something that's critical to our infrastructure, to our ability to recruit new industries and to invest in our workers and our people. So, I'm grateful for Senator Jones and Representative Sewell, and I would love the rest of our congressional delegation to support that. We have been in touch with them. We've sent letters and petitions. You can also, if you're interested in contacting our members of Congress about this, please visit coveralabama.org, which is our coalition page. There is a take action note where you can easily email your member of Congress and Senator Shelby and say, look, this is a great bill. We really need your help to get more funding for Medicaid in Alabama.
Well, right. We're saying here in the middle of a pandemic that you can't build the social safety net when you're in the middle of a crisis. You have to do it beforehand. And so there will be future crises. I mean, obviously we need to build it now, but there will be future crises. Well, let's talk a little bit about maybe some of the pushback that you are receiving from the rest of our congressional delegation and from the state. The political reality being what it is in Alabama right now, and there not seeming to be the will from Governor Ivey to expand Medicaid. What are some alternatives to get more people in the state covered? Are there any?
There is nothing that I'm aware of that would have the immediate critical impact of ensuring over 300,000 people in our state for the small amount of money that we're talking about. I know that the legislature has considered other bills that would provide a little bit more funding for mental health, provide more funding to address things like maternal and infant mortality, which are crises that our state has acknowledged need to be handled. But there's no question that the driver behind all of these is this huge gap in coverage for all these uninsured people. That said, I think I'm very encouraged that Governor Ivey and members of her staff that we've met with have said, hey, like, we want to look at this. Let's look at how to pay for it. And we think there are, a lot of ways our state could decide to pay for Medicaid expansion, even without an enhanced federal match. We're open to talking more to any lawmakers or leaders in our state who are open to that discussion. And we really want to show, like, yes, this is the cost, but this is the benefit. I feel more hopeful now than I have in the past 10 years that we've been working on this issue. I think the last 10 years have shown us the cost of our inaction. And, as you said, you can't build a safety net in the middle of a crisis, but what you can do is point to the immediate threat and say, the best time would have been, 3 years ago. The next best time is today.
Mm-hmm.
So the sooner we act, the sooner we'll be able to gear up with things like distributing, a COVID vaccine when it's available. What about all the people who don't have health insurance or access to healthcare? As you said, there may be another health crisis or another pandemic. Flu season is coming. So we've got all these critical and essential workers who we're relying on to keep our economy going. And even as we've partially reopened some industries, a lot of those folks that we're relying on to keep it moving are working without critical coverage. And I'm hoping that that's making this issue hit closer to home for our lawmakers and our leaders.
As we're wrapping up, we always hear a lot of misconceptions and maybe misinformation around topics like these. Some may say, oh, well, this is socialized medicine, or this might, hurt my ability to see whichever doctor I want to see. Particularly for people who live in maybe Birmingham's over the mountain communities or in Huntsville or other affluent parts of the state. This isn't going to affect anybody's ability to see their own preferred doctor, right? This is just giving more people the ability to see a doctor. Is that the case?
Yeah, the biggest thing that's going to threaten your ability to see your doctor is when more rural hospitals close, more of our neighbors who live out in the suburbs and rural areas no longer have their own pediatrician. Guess where they're going to come? They're going to be coming to UAB. They're going to come to Brookwood. They're going to come to maybe where you go to get healthcare. And it's not like demand for healthcare is decreasing. It's just that providers are not as plentiful as we need them to be. So there's plenty of healthcare to go around if we can fully fund the care. We obviously need to work on bringing providers to more rural communities and underserved areas. But I think the bigger threat to all of us is that if we continue to ignore this issue and ignore the huge rates of uninsurance, it will impact you, and it will impact how you're able to see your doctor. It could be the hospital that's closed on your drive to the beach, and you really need healthcare, and it's nowhere within a 3-hour drive. It could be your family home where suddenly there's no longer an OBGYN in your whole county. There's no labor or delivery unit. But you really want to move back home and invest in your community. Well, it's really hard to do that.
Right.
So I would flip that question and say, we are all going to suffer from less access to care the longer we wait to cover more people.
Well, thanks, Robyn. For those of you watching, you can find out more about Alabama Arise at alarise.org. You can also go to coveralabama.org to learn more about what we've been discussing today. And for more on this topic, check out the Reckon Interview podcast, wherever you get your podcast. This week, we've gone into the long, long history of how Alabama's and the South's healthcare system got so fragmented. Thank you for watching, and thanks again, Robyn.
Thanks, y'all. Have a good afternoon.